working for your health. Sponsored by HCA Virginia.
Back and neck pain are common problems, even for young and active people. Sometimes surgery is the only answer for a ruptured disc, but now doctors are starting to replace an age-old surgery with a newer treatment that has people back on their feet almost immediately. Our Tracy Sears is working for your health.
At 35, John Larson is thankful to be healthy and back on the job, answering the call for help.
Just daily calls can be rigorous. Fire calls are particularly strenuous.
But just recently, Larson faced the scary prospect of not returning to his job as a firefighter when he developed a ruptured disc in his neck.
The herniated disc created a pinched nerve in my neck, which presented pain significantly in my shoulder and left arm. So I was out of work that entire time.
Larson's physician, Dr. Matthew Mayr, says cervical herniated discs are common, especially for younger patients in physically demanding jobs.
And they tend to wear out their necks quicker. So we see a lot of younger people with herniated discs or with disc spurs in their neck that end up needing a surgery.
The cervical disc in the neck act as cushions that lie between the cervical vertebrae. When damaged, they can press on the spinal cord or spinal nerves, creating pain, numbness, or weakness. Up until recently, surgeries required spinal fusions, which placed more pressure on the surrounding vertebrae, reducing the range of motion for patients. Now doctors like Mayr are performing cervical disc replacement surgery, replacing the damaged disc with an artificial one, an outpatient procedure that is performed through a small incision in the neck.
Because we don't have to do a fusion, the nice thing is as soon as their wound is healed, just in a couple days, they can do pretty much anything they want.
Once the surgery was completed, I had virtually no pain other than the incision on my neck.
Larson was surprised to get the all clear to return to work so he could once again do what he loved, pain-free.
I'm so glad I did it. It was probably the best decision I made.
This past year, the FDA approved the surgery for patients who need more than one disc replaced. To see if you're a candidate for cervical disc replacement, you should talk to your doctor. Working for your health, I'm Tracy Sears.